In today's session, we will be discussing about the 7 core elements of antimicrobial stewardship. This is not in the textbook. This is an additional topic that I'm teaching, that you will have an idea about antimicrobial stewardship. What are the main aspects of this? Okay, not from the textbook. No page number is there. Okay, if anyone is joining late, please help them out. So first element is leadership commitment and accountability. Leadership commitment and a single leader should be responsible for the program outcomes. Usually, it is the chairman of the hospital or the senior most microbiologist. Okay, either of the two is the leader of this program. Okay, and according to the Central Disease Control CDC's website, physician leaders are more particularly effective for antimicrobial stewardship programs, like a microbiologist or somebody who's from the medical team, not from the management or a commerce background. Okay, they are more accountable. Okay, then you have reporting. That is the second element. Under the reporting, you have communication feedback, audit feedback, monitoring of the antimicrobial consumption, policies and guidelines revision. Okay, these reports should be made on all of these areas. Okay, the program should include regular reporting of the information on how antibiotics are being used, resistance to doctors, nurses, and relevant staff. Okay, these things has to be reported. Okay, who is following the protocol, who is doing the proper auditing, who is doing the proper prescription. Okay, what is the pharmacy's role? Okay, all these feedback, at least quarterly feedback, has to be submitted to the antimicrobial stewardship team. Okay, and policies and guidelines every year you will have to change based on what new antibiotics are being released or what new strategies or principles they have adopted worldwide regarding the antimicrobial resistance. Okay, what are the new policies? What are the new takeaways? Okay, that has to be revised in your guidelines and policies as well. And regularly monitoring how antibiotics are being consumed. Is the graph going down? Ideally, the graph of consumption of antibiotics should go down. Okay, so there should be a report that is tracking the statistics of how much antibiotics are being consumed on a monthly basis or on a weekly basis. Okay, then education from the college itself, when new medical practitioners are being trained, may it be doctors, nurses, physiotherapists, anyone from the medical field, from the pharmacology, PharmD, okay? Anyone who is going to practice as a healthcare practitioner in the future, these educational colleges from the undergraduate educational syllabus itself has to be in that it has to be mentioned about the importance of antimicrobial resistance, antibiotic stewardship. Okay, this has to be the main part included in each of the syllabus, not just undergraduate, but post graduation as well, and also in CMEs and CNE, continuous education, even when you start working. Okay, in service training, public awareness in all these areas. Public awareness is a community education. Okay, media can play a very important role in teaching people the abuse and the side effects of antimicrobial abuse. Okay, so you have to educate clinicians about the resistance, antimicrobial resistance, optimal prescribing techniques. The nurses have to identify which are the high risk patients who may be having antimicrobial resistance and report it to their colleagues. Okay, so this is another area. Then tracking. Okay, so you have to monitor the antimicrobial prescribing, whichever clinicians are on prescription or whoever are eligible for prescription, the prescriptions has to be monitored. Okay, And what are the resistant patterns you see? Which certain hospitals have certain common resistant bacteria, strains of bacteria and viruses. Okay, certain bacteria are common in certain wards. Not every ward will have the same strain of resistant bacteria. Okay, so with environmental scanning and all, you will understand. And also with patients' blood sample monitoring or patients' biological assay monitoring, you will understand which are the common resistant viruses or bacteria you face in your hospital. Okay, so you have to have a collaboration with the microbiology department because they are the ones who are tracking the samples. Okay, and they have the data which is the most common resistance that you are facing in the hospital. Cumulative antimicrobial susceptibility report. Okay, on a weekly basis. Okay, or on a monthly basis, week 1, week 2, week 3. Okay, who all are susceptible to antimicrobial resistance. Okay, that report has to be submitted. Monitoring of antimicrobial consumption, again, how much the patients are using, for how long. Okay, are they correctly taking their medications or not? Okay, prescription charts has to be antibiogram and all. Okay, these has to be checked, that based on the antibiogram, are the physicians prescribing, or are they going out of their way and for prescribing some antibiotics which should not be prescribed. Okay, proper auditing and feedback. So doing all these steps one by one, you are automatically tracking. Okay, the situation, the current situation you're tracking. You can't do much on right now, but you at least have the awareness of what is going on. So in the next meeting, you can come up with certain changes that can be implemented. Then antimicrobial expertise or drug expertise. A single pharmacist leader should be in charge of this, who should be responsible for working to improve the antibiotic use. Okay, and also they have to also make sure that all the clinicians are undergoing their continuous education and in-service training regarding the same. Okay, and you can also give awards for antimicrobial champion. Okay, monthly awards for physicians who successively reduced the prescription of antibiotics and they are treating their patients well. There is a success rate in the prognosis of their patients with reduced consumption of antibiotics. So automatically you can you can make them antimicrobial champion on a monthly wise. You can have selection criteria on this. Okay, so the staffs will feel more motivated, okay, to be a part of it. Then action, you have to implement at least one recommended action. For example, let's say systemic evaluation of ongoing treatment after the set period of initial treatment. For example, a patient is admitted today. The first 2 days intensively, you will give the initial treatment. Okay. So certain, if infection has been confirmed, certain antimicrobials will be prescribed. Okay. To relieve the patient. After 2 days, you again check the blood reports. Now the bacteria may have changed, or the antibiotics that you have prescribed for which is going on since the past 2 days, it is not working. Okay, so the bacteria may have changed, or the patient may have got new strain of bacteria. Okay, so again, after initial treatment, the ongoing treatment will have a different set of drugs, different set of antibiotics. Okay, so that is action based on the ongoing prognosis of the patient. That it is divided into initial treatment, systemic ongoing treatment. Okay, so drugs may change in that. And when should the drugs change? Only when you have understood that the antimicrobial that you have prescribed will not work on this bacterial strain, and this bacterial strain requires another class of antibiotics to tackle the issue. Only then you have to shift your drugs. Okay, so that's a part of an action. And this is a multidisciplinary collaboration. Okay, it's not a burden of just one department of the hospital to take care of the antibiotic stewardship burden. Okay, and every step, each and every step, every element should be in collaboration with the microbiology department. Okay, it's usually the senior microbiologist who will be the leader of the antimicrobial stewardship program. And the activities The most common activities as a part of action that we take up here is policies and guidelines, which has to be revised on an annual basis. So somebody should be responsible for keeping a track of what is going on worldwide. Okay, what are the international organizations saying right now about the antibiotic stewardship? What new challenges are we facing? How can we tackle those new challenges with new guidelines? Okay, so that becomes one action, okay, that the group has to do, that the committee has to do. Then antimicrobial prescription charts, okay, that is antibiogram. The another name for that is antibiogram. Okay, at a regional level you can follow one antibiogram. So antibiogram is the list of bacterial infections and its adjacent medications and antibiotics which can tackle this specific bacterial infection. Okay, you don't require a broad spectrum antibiotic for all bacterial infection. Certain infections like E. coli and streptococcus and all, with narrow spectrum antibiotics you can deal with it. You don't require broad spectrum antibiotics for such small infections. Okay, so antibiogram gives you an insight on this. What is the infection the patient is going through and what exact class of antibiotic you should use to deal with this infection without jumping the classes. Okay, confirm the indication. Don't use antibiotics for viral infections and fungal infections. Only bacterial infections should be treated with antibiotics. Request blood cultures. When you doubt that the ongoing antibiotic treatment is not working at its best, then you have to request for new blood cultures. Then de-escalation. Each and every action of yours should be targeted to bring down the rates of antimicrobial resistant cases. Okay, so that is de-escalation. You have to bring down the cases of antimicrobial resistant cases. And auditing and feedback should be done in respective departments. Prescription auditing, pharmaceutical auditing, it has to be done. Okay. So that's about the 7 core elements of antimicrobial resistance. If you have any queries, you can mention in the text in the chat box.